So in this video, I'm going to be talking about specific arthrofibrosis, which is essentially scar tissue that is limiting range of motion, and potentially both flexion and extension can be affected. In this video, I'm going to be talking about a complication that potentially can happen after ACL surgery. And it's good for us to be aware of these things just so we can identify them early and get them addressed quickly to not waste any time in rehab. So in this video, I'm going to be talking about specific arthrofibrosis, which is essentially scar tissue that is limiting range of motion, and potentially both flexion and extension can be affected, as opposed to a cyclops lesion, which is only for extension deficits. So when you're looking at, there's a couple of studies by Sanders and, forgive me, I'm going to look at the name, Acl. They found ranges from between 2% to 38%. And what they found out, the reason why there's such a wide range in their studies, which they included a bunch of different studies in it, is because of there is no clear-cut definition, or at least not a consistent definition of arthrofibrosis. And even with that wide range, they actually only found that between 3 and 5% of people actually need some sort of surgery to resolve the scar tissue. We know that, after surgery, there's going to be scar tissue that's involved. And for us on the rehab side, it's a matter of whether or not it's actually impeding the progress of the patient. So for the 3 to 5% of people that actually it does affect, that end up needing surgery, I think it's really important to address this early and often. The reason why, and I'm going to give you a specific example, is because two of mine in particular, is because I had one girl who is a high-level lacrosse player in college. I was seeing her over the summertime when she was back for break. She was about 3 months post-op when she came to see me. She kind of had this, this constant knee pain in the front, in the front of her knee. We're trying to do some flexion and extension kind of came back a little bit, lacking a few degrees here and there. Flexion, she was missing about 15 degrees or so. And she kept telling me, it feels like my range of motion just hits a wall. Like I just can't move it anymore. She went back to school over the summertime for like a weekend break or something like that. Saw her ortho. Ortho was very dismissive of it. She was kind of the ortho was kind of like, oh, just it'll work itself out. And on the rehab side, I kept thinking in the back of my head, like it seems like scar tissue. It seems like scar tissue. And I kind of like explained to her what it should feel like, and she's like, that's spot on what it feels like. And then, the summer went on. We did our best in rehab. But it's still in the back of my mind. I felt like there was something that was slowing down the progress or not allowing us to really take it to the next level. Okay. She went back to school in August. Again, told them what she was feeling in the front of her knee, and they were still kind of dismissive of it. October, she was kind of like, I think I need to get this checked out. I think something is wrong. They did an MRI, and they found, sure enough, it was scar tissue. And a week later, she ended up getting scar tissue removal, which sure enough, it was a decent amount of scar tissue that ended up getting removed. So the reason why I was so pressed about sharing this in particular was because you think back to when I found it in June or July. They could have done it back in June and July, but we ended up wasting 4 or 5 months of rehab when this could have been resolved way earlier. Fast forward to the next year, I actually got a friend of hers who came in to see me. Her flexion stopped at 125, regardless of how much time we spent. And this is a, pretty skinny girl who had about 145 to 150 degrees of knee flexion. But at 125, it just stopped. She kept telling me it hit a wall. It hits a wall. I physically cannot go anymore. It hurts. So again, we sent her back to her school. The ortho again was pretty dismissive of it. And then I actually told the parents about the other girl from the previous year. And sure enough, they actually pressed, the surgeon was like, you are giving my daughter an MRI. Saw the MRI. They actually thought initially it was a meniscus tear. And I was like, that doesn't make any sense. We haven't done any pounding. We haven't done anything like that. That's too aggressive. So they're like, okay, they went into surgery thinking that it was going to be either meniscectomy or a meniscus repair. Came out of surgery. The surgeon said that he removed the biggest scar tissue he's ever removed in his, 15, 20 years of working. So that one was obviously so much better because we were able to resolve it right away. So at 125, I actually saw her 2 days after her surgery. She went from 125 to 140 right away, and then within the next week, she was back to her full range at 150. So these are kind of two case studies in my experience that really made a difference as far as getting scar tissue removal. So for us, as far as recognition goes, you're looking at limited range of motion, right? That obviously makes sense because scar tissue is impeding it. Additionally, they might report of anterior knee pain in the front. In my experience, patients will tell you that I hit a wall. I feel like my knee motion just can't go anymore. Those are kind of the big three things that you want to look for that can potentially, I guess, set off some alarms in your head about like, hey, we potentially may need to get this checked out. Usually I'll wait a little bit. I'll make sure that they're doing their homework. We'll make sure that we're making sure are doing diligent rehab, trying to kind of push them through range of motion manually. If nothing is working, 2-3 weeks goes by and nothing is changing for range of motion, you really want to be thinking about reaching out to the ortho and think about getting some imaging done and potentially getting scar tissue removal. So hopefully you guys found this helpful. I'm going to link those 2 articles below. And also, as far as like pre-operatively, if we can, again, they found some things that can potentially cause scar tissue, which is limited range of motion, swelling, things that, again, we've talked about pre-operatively that make a big difference, and they could potentially prevent some of these complications like arthrofibrosis. So hopefully you guys found this video helpful in regards to things symptoms that we can look for, that we should be aware of, because again, we can save a lot of time in rehab and making the athlete feel better. So hopefully you guys found this video helpful. Thank you for watching today's video. Please feel free to like and subscribe and share it on your social media platforms. If you're interested, I have started an Acl Mastering Group, which is a growing library of content centered around ACL rehab. It has exercises ranging from immediate post-op to late-stage sport-specific movements and everything in between. It's a growing library and currently holds over 250 videos. There's content centered around assessments, movement breakdowns, exercise breakdowns, case studies, and a whole lot more. You also gain access to a private forum where you can engage with like-minded people, ask questions, share research articles, and share resources. If you're interested, please feel free to click the link below. Thank you for watching.